Hi guys. We're going to work on chapter one um, by virtual. Okay. So there's a couple things you'll need to do, and I'll tell you as we go. But we're right now just kind of talking about introduction to phlebotomy. Okay. So let's move on. In this, our learning objectives are going to be you need to know how to define phlebotomy, list at least 5 job skills that are important for phlebotomists. Okay. Describe the major duty of phlebotomists and discuss 4 other responsibilities that are important. You're going to list 6 personal qualities and attributes that characterize a professional and explain how phlebotomists demonstrate these qualities. Okay. You're going to know about accreditations and certifications and professional organizations, and explain why informed consent and confidentiality are important legal issues for a phlebotomist. Okay, so we're going to do a pre-test, and what I'd like you to do, I'm going to give you the questions. You can also go to that chapter 1 at the end there and look at the answers there, okay? But I do want you to do this because we've got to get it in our heads. So, what does the term phlebotomy actually mean? Okay, so it actually means an incision of a vein, okay? A duty associated with routine blood collection includes transporting sample to a laboratory. Okay. Which of the following acronyms is not a certification agency for phlebotomists? Do you know? The NAACLS. Okay. Which of the following terms is evidence that an individual has demonstrated proficiency in a particular area of practice? So that would be a certification. Okay. A phlebotomist must ensure that the patient understands and agrees that his or her blood is going to be drawn. Okay. What is the name of this process? It's informed consent. Okay. The Health Insurance Portable Accountability Act of 1996 regulates which of the following areas? So that was developed for the privacy of health information. That's HIPAA. Okay. You have entered a patient's room and explained that you need to draw blood, and the patient repeatedly refuses. What should you do? Okay, in this situation, you're going to notify the patient's physician according to the institution's written policies. Okay, number 8. Um, let's see here. The term informed consent means what? It means a patient must be informed of all intended treatments and risks before the treatments are performed. Okay. Which of the following is true of phlebotomy? Believe it or not, phlebotomy is an ancient profession dating back at least 3,500 years ago. That's crazy, isn't it? Okay. Which of the following professionals perform a variety of tasks related to specimen preparation in the clinical lab? It would be the first one, assessor. Okay. After becoming certified, what is the requirement for you to maintain your certification? It is participate in continuing education programs. Number 12, what is the term given to any information about the patient's health status, treatment, or payment for health care? And it is protected health information. Okay. Number 13, let me see if I can move my little thing here so you can see. A successful quality healthcare professional is one who, what do you guys think? I think it exhibits emotional stability. Okay. All right, let's move on. Whoop. Okay. What is phlebotomy? Okay. What is phlebotomy? Um, It's the practice of drawing blood. If you break down the word, phlebos means vein, and otomy, of course, means to make an incision. Modern phlebotomy, job skills and training. So you need high school diploma or a GED to enter training programs. Technical knowledge, organization, ability to prioritize your tasks, attention to details, good interpersonal skills, ability to deal with difficult patients, and ability to handle stress. All right, so some job duties. You're going to collect blood samples according to the procedures, adhere to safety infection regulations, effectively interact with both patients and healthcare professionals, keep accurate records, be knowledgeable of computer operations of the laboratory, develop other healthcare skills needed for day-to-day patient care in a job setting. Okay. Personal characteristics. You need to be dependable, so that means you get to work on time, you avoid being absent or tardy. Honesty, integrity, reporting errors when they happen, positive attitude, make others around you feel positive, empathy and compassion. So be sensitive to the patient's concerns and reassure anxious patients. Okay. Professional detachment. Be sympathetic and understanding. Retain professional distance to do job efficiently. Professional appearance, remember we talked about this. Cleanliness and grooming are critical. So you don't want to show up to work and your hair's all mess and you haven't showered and you might even have a smell to you and you're about to take somebody's blood. Not a good situation, okay? Interpersonal skills, you must learn to communicate effectively with patients and coworkers. So that means by making good eye contact with people when you're talking to them, staying calm at all times. You also, with the grooming, you don't want to be wearing a lot of makeup. You don't want to have dangly earrings and all this jewelry on, and especially don't want to have strong perfume, okay? A lot of people are actually allergic to that. Okay. Answer the phone promptly. So this is all phone skills. Smile when you're speaking. Identify the department and yourself. Ask how you can help. Write everything down. Name, phone number, the person calling, date, time they called. Okay. You're going to want to speak slowly and clearly. Remember, not everybody can generate, things that are going too fast. If it's an older person and you're blah, 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 they're not going to be able to catch what you're saying, okay? Somebody may be stressed out. Again, if you're being real short with them, that may not go over well, okay? So ask questions if you're not sure what the caller means. Do not put the person on hold until you determine if it is an emergency or not, and only give accurate information. Several organizations that develop standards and monitor training in the program are in the field for program approval, phlebotomist certification, and continuing medical education. Okay. After becoming certified, you may need to participate in continuing education, and you will. Membership in professional organizations offer additional ways to stay updated. So after you get certified, you might want to look into some different organizations, and they actually will constantly send you literature on, and that'll help you keep up to date. Accreditation, approval from an organization by meeting established standards. Certification means demonstrated proficiency in a particular area of practice by passing an exam. Some states require certification, and that's what you guys are going for. And then continuing education is, like it says, you're going to earn CEUs to do some maybe online stuff, or you might go to a seminar, or might actually be a hands-on training. All right, organizations. So these are just different organizations that offer continuing education. So you can take a look at that. What does informed consent mean? So a patient must be informed of what's going to happen to them. They need to know what the treatment is and what the risks are, okay? Patient's right of refusal. Patient has the right to refuse any medical treatment, including phlebotomy, okay? If the patient refuses, then you're going to go and let the physician know this, okay? But you follow the the institution's policies. You guys know what confidentiality is, and I can't stress this enough, but all information regarding a patient's condition, test ordered, or results are confidential. And HIPAA is the law that requires procedures to be in place to protect the person's privacy. So the protected health information, or the PHI. All right, so here's just a couple of questions from the back of that chapter. So the procedures that we're going to do, I really want you to go through, before you start, we're going to try to take a pretest just to see what we all know, okay? Then we'll go through the literature and stuff, and then we'll take the post-test, and then we will also take these questions. Now, these questions are geared to your certification. So I really am going to stress that you do this part to make sure that we keep practicing so that when we go and take that exam, it's going to breeze right through, okay? So number one says phlebotomy skills would not include, and here are your answers, okay? Now I'm going to give you the answers, but I stress that you go on your own and take the quiz at the end, okay, of that chapter. Okay, so phlebotomy skills would not include handling patient correspondence, okay? They would include organization, interpersonal skills, and being able to handle stress. B, the monitoring system for institutions that train phlebotomists is known as accreditation, okay? And once certified, what must a phlebotomist earn to ensure continued certification? You guys remember? CEUs, okay. Informed consent means what? It means that patients must be informed of intended treatments and their risks before they are performed. All right, E, which characteristics is not required personal characteristic of a professional phlebotomist? So what do you think is not necessary? It's not necessary to have a sense of humor. Might be a great quality to have, but it's not a personal characteristic, okay? And when a patient is in the hospital, refuses to have the blood drawn, what does the phlebotomist do? Let me see if I can move this so you can see the other answers. Okay, so it would be notify the patient's nurse to ensure that the physician or other ordering practitioner is notified promptly. Okay, so we need to make sure that that doctor knows that they have not done that. Okay, so from there, I have a thing for you to think about. This is called critical thinking. Two phlebotomists are discussing a patient's condition in the elevator. They are overheard by the patient's daughter. How would law and professional ethics apply to this incident? So I want you to think about that. And we might have a little discussion of that when we get together in an actual class together, okay? Like I said, I want you to review page 325, or not 325, I'm sorry, the end of chapter 1, and go over the mock certification study questions and the certification exam prep questions. All right, so let's get back to this question here. So these phlebotomists are in the elevator and they're talking about the patient and the condition, maybe the results of stuff, of tests that, you know, maybe the person tested HIV positive and they're in there talking, blah, 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 blah. Well, the daughter's in there also and she overhears this. So what do you guys think could happen here? Okay, first of all, we've broken HIPAA, correct? All right, so we have to be careful not to discuss patient information because it can be overheard by anybody, number one, but we shouldn't be doing it anyways. That is private information. As medical professionals, you have to be aware that you are responsible to keep people's information private. That means you're not going to talk with your friends. If you have other people on the unit that you know, you're not going to share that information, okay? It's unprofessional to share it. An unauthorized release could actually be you could be charged for that. Okay, so you can charge of invasion of privacy. So let's just keep that in mind. All right, so this is chapter 1. On your Blackboard is post-review questions that you need to complete. Please do that. And if there are any attached videos for you to watch, please do that before the next class. And I'll see you in the next chapter.